We have everything from digital core fellows who are early career and trying to figure out how do we get early career talent into the agency? How are we building the next generation of talent in, to super senior software engineers who are coming from, Silicon Valley firms that you've heard of. We have people who worked at Spotify, Twitter, Google, Pinterest, Disney, right? Like household brand names.
Today on the Daily Scoop podcast from the Scoop News Group, inside CMS's work to become more digital and open source. Andrea Fletcher, the head of digital service at CMS, joins the podcast. It's Tuesday, October 22nd, 2024. Welcome to the Daily Scoop podcast, where you'll hear the latest news and trends facing government leaders. I'm the host of the Daily Scoop podcast, Billy Mitchell. Thanks so much for joining me. Let's get to today's top headlines. The Federal Bureau of Investigation is using artificial intelligence to mine tips about potential threats, but is revealing little about how the system actually works. Specifically, the Bureau is using a system it calls the Complaint Lead Value Probability to prioritize tips by conducting algorithm scores and triaging according to two versions of an agency AI disclosure. The technology, which is meant to help sort through the tips the FBI receives, is one of several AI tools employed by a bureau that also uses Amazon's recognition software and drug signature algorithms. Still, the FBI provides little insight into how this system, which could theoretically determine the threats that get addressed, actually works. A recent public records request filed by FedScoop saw much of the information redacted, including a section on scores that could possibly reference the efficacy of the algorithms. In other news, the Department of Labor is spelling out how artificial intelligence can boost job quality without harming the rights of workers, releasing a roadmap last week that aims to empower workforces in underserved communities as use of the emerging technology proliferates. The 17-page document titled Artificial Intelligence and Worker Wellbeing, Principles and Best Practices for Developers and Employers details 8 key priorities for AI companies and management to follow that are intended to keep the focus on centering worker empowerment and well-being. The 8 principles identified by DOL for developers and employers are centering worker empowerment, ethically developing AI, establishing AI governance and human oversight, ensuring transparency in AI use, protecting labor and employment rights, using AI to enable workers, supporting workers impacted by AI, and ensuring responsible use of worker data. For more news at the intersection of the federal government and technology, visit fedscoop.com. If you're like me, you probably look back on the troubled rollout of healthcare.gov as a sort of contemporary case for why modern IT procurement and digital services in the federal government are so important. That infamous moment spotlighted the plagued approach that the federal government used, and in many cases is still using, to build and buy technology in an outdated way. However, good did come out of it. It led to a lasting response to bring about change by spurring the creation of the White House's digital firefighting team, known as the U.S. Digital Service. And since the creation of the USDS in 2014, several federal agencies have chartered associated offshoots like the VA, the DoD, and the Centers for Medicare and Medicaid Services, injecting those modern digital principles into the mission work at those agencies. At CMS in particular, the digital service team plays an integral role working to transform how the federal government delivers healthcare to the American people, from assisting with the implementation of a new 988 suicide and crisis lifeline to improving transparency and accessibility of the U.S. healthcare system. Andrea Fletcher is the head of that team, and she joins me in part 1 of a 2-part episode for a wide-ranging discussion on the history of digital service at CMS, the major themes and challenges the team faces, and what's next. Let's go now to that interview with Andrea Fletcher. Andrea, so good to see you again. Welcome to the Daily Scoop podcast. Thanks for joining me.
Thanks, Billy. Thanks for having me.
Absolutely. Well, I'm really excited to dive in. The last time I saw you, we were at a GDIT event earlier this year. You were talking about generative AI. You had the entire crowd laughing at some of the examples you had in your PowerPoint. And we'll get to that a bit. But, I wanted to start our conversation with sort of the CMS digital service journey. Obviously, I think listeners are going to be familiar with USDS and how there's sort of offshoots at various departments, not every, but some agencies like CMS have them, VA has one, and some others, HHS. So I'd love to start there and kind of go back through the history of the CMS digital service team and kind of get that history lesson from you on why it was created, where is it at today, and sort of what's the vision for that team in helping CMS accomplish some of its digital era goals.
Yeah, so it starts in about 2014, that journey under the Obama administration with healthcare.gov, right? And so that was kind of the initial, that's the USDS origin story of, okay, we're launching a website, the president's talking about it on TV. The launch doesn't go so well. I think that's pretty well known. And CMS has a variety of things that it would have done differently, right? In a launch like that, and how we organize ourselves as an agency because I think a lot of people at CMS knew that wasn't going well, and it wasn't communicated up. There wasn't help that came in early enough. So how do we have a team, or how do we have different resources available for the agency? Because we have had multiple instances of healthcare.govs that have gone really well since then. And a lot of that is the result of having technologists in the room, whether that's with our Office of Communications, which leads our websites, our Office of Information Technology, who's leading the networks and the hardware, right? Or our different centers who lead programs, right? So we have 3 major programs at CMS. We have Medicare, which covers about 36 million people a year. Sorry, 64 million. Wow. I always get Medicare, and the marketplace is 34 million. And it's open enrollment right now, so they're getting bombarded. Yeah. And then also Medicaid, which is 88 million people. And we just went through the public health emergency unwinding. And, we get a lot of people visiting these major websites. And so what our team does is we sit in the office of the administrator. I wear kind of 2 hats. One hat is managing a team of 30 to 40 on any given cycle, technologists who are here on a tour of service. We have everything from digital core fellows who are early career and trying to figure out how do we get early career talent into the agency? How are we building the next generation of talent in, to super, super senior software engineers who are coming from, Silicon Valley firms that you've heard of. We have people who worked at Spotify, Twitter, Google, Pinterest, Disney, right? Like household brand names who are now coming into CMS to run whenever we say, hey, we think we have a problem over here. Can you take a look at it before it gets bad, right? Or before we end up on the Washington Post front page article. How do we stop that stuff from happening? And how do we make the conversation about how great CMS's delivery is, not, oh no, that form fell over, or we tried to fill this out and nobody could get through, right? So making sure we're user testing, making sure we're bringing in best practices around site reliability and software development. So that's kind of one hat I wear, is just managing the team. The other hat is advising CMS leadership. So I talk with a lot of directors, a lot of center directors who are trying to figure out, hey, we have this problem over here, or hey, we're trying to implement new technology. What do you think of this? Can you help us frame the problem in a new way? Can we bring in some people to help, on something that's just giving them challenges, right? So, working with senior leadership across the agency on new strategies and directions that the agency is going to go in, and then also firefighting, right? So putting fire, we like to say we're Smokey the Bear, right? Putting fires out before they start, making sure that, we have lots of technical teams across the agency, and that we're working together and people are talking to each other, and that we're all moving together. And that if we do have problems, we're elevating those quickly and getting to solutions fast, rather than, waiting for months on months, because, that's often what happens in the government, right? You're waiting for resources, you're waiting for the right staff, for more money. And so, sometimes our job is to just get in there without any of that. We don't have to wait 6 months to hire people. We don't have to wait 6 months for funding to come through. We already have people in place who are flexible enough to go around.
I do want to follow up quickly on one of your two hats that you wear, because I find it so interesting in the government space, and there's increasingly more of you out there as these sort of senior technology advisors to leadership. And
Yeah.
I find that role so fascinating because inherently the leaders aren't the technologists at the table. So you need folks like you. So how does that conversation work? And is it, I'm not going to ask you to give,
Yeah.
details on those conversations, but I can imagine that sometimes there's resistance, there's challenges. People aren't as tech proficient as, somebody who's come up in the tech world. So how do you kind of advocate for tech in that sort of
Yeah,
role?
I mean, we work with a lot of medical doctors, for example, right? Like we have a lot of clinicians, a lot of people who are experts in healthcare policy and in healthcare, but technology is not their expertise. Also, government technology is not the same as building a website from scratch,
Mhm.
right? Like we are dealing with legacy systems, we're dealing with COBOL and mainframes and stuff that was built before I was born in some cases, right? So it's not like we're also getting we're not always getting the shiniest new toy, right? That we get to just go play with and build really cool, exciting technology. We actually have to build really boring technology that works well,
Yeah.
right? Like we need stuff that is infrastructure and is easy to use and is not like I love the conversation around AI, but it also feels like there's this shiny thing that is so great. And it's like, we got to get the basics right here, right? Like we have to have functional websites that help millions of Americans, hundreds of millions of Americans sign up for healthcare, right? Like that is the bread and butter of the work that we do. We have to process claims. We're a Medicare claims processing engine, right? And so a lot of the conversation is, what are the processes that we have? What are the things that we need to do in order to make our programs run? How are they working now? And how do we do it better? Faster, cheaper, more reliable, right? And that's a lot of what I have to do is de-jargon the technology. I have a conversation that always sticks in my mind where I said, "Oh, we're going to put the Python and Jupyter notebooks on GitHub," right? And like, then I realized how crazy that sounds if you don't know what any of those things are, because tech has this weird lingo that we use, right? And you kind of had to say, "Oh, sorry, we're gonna put the data analysis like in a place where we can all access it," right? So it's
Exactly.
constantly translating between the program needs and the policy needs and the technology, and trying to get people to understand the problem, but without jargoning them to death with acronyms too. That's the other fun thing. Throw in government acronyms, throw in tech jargon, and nobody's speaking the same language.
Well, I think that brings us to a good point, because it sounds like you have a background in tech, and you've shared sort of the history of CMS digital service and the USDS in a broad sense with healthcare.gov. How did you get involved? I would imagine you're a tech transplant who joined government.
I am.
But so how did you get started? And that's not the. There are a lot of people who take that path, but there's more who don't. So how did you go about deciding to do that?
Yeah. So my background isn't actually in public health. I have a master's in public health, and I accidentally went to work for a startup in technology around healthcare. I actually spent the first 10 years of my career mostly in sub-Saharan Africa.
Oh, wow.
So yeah, I worked at a mobile app firm called Damagi, and then I worked at another firm, a data firm called Cooper Smith. And I was working with governments. I was working with mostly African governments who were leapfrogging the US, right? So we were rolling out national electronic health record systems that were on tablets, right, and smartphones, and were very much driven around clinical decision making. So I built a lot of apps for community health workers. I used to go on visits. I would go on home visits with them and did a lot of user research on what data are we collecting? Do we need to collect this data? How are we using this data? How is it flowing the whole way up to the top level decision makers at the Ministry of Health? And what is the process of, I'm a community health worker who's standing in front of, a woman and her child. How am I providing them better information? And then what information am I collecting? So I did a lot of basically data strategy or information strategy for healthcare workers. And it was super informative because I was building apps, right? I was building mobile smartphone apps on mostly Android, using open source software. That's one of the reasons I'm a huge proponent of open source software, because we were building these with tiny budgets, but because we were leveraging existing technology and we were doing so much user research to get it right the first time, we didn't have money to waste, right? So you had to make sure that the app that you were building was actually going to be useful, and that you were giving people what they wanted, because we couldn't afford to do this again, right? And I think that just really put a different mindset in how we deliver technology, like being very user-centered and very focused on what is this going to do? Do we need to collect this data, right? What are we going to do with this information once we get it? What's the flow of it? And then also I learned how to navigate governments, right? I used to work in countries where we didn't have policies on data security for mobile technology, right? Like this was early on in mobile tech kind of hitting the market. And this was very new in many instances. And so how do we work with governments to make sure that we're doing things safely and securely? And what, governments have limited resources in many cases for healthcare. So how are we using those resources wisely and piloting rather than trying to go national scale on day one, right? Like thinking through some of these really iterative design processes in order to make sure that we're being smart about our use cases, right? And building the best technology that they can have. So I learned a lot about navigating governments, which I think one of my favorite things coming into the US government is all governments are the same. Bureaucracy is bureaucracy, no matter where you go, right? But the idea of socializing work before you do it, right? So socializing the technology, socializing the project, making sure that you have buy-in, figuring out who your coalition of the willing is, right? Like who's going to help you, who's going to be a roadblock in all of this, whose approvals do you need to get, who are the key stakeholders, and then what do they need? What information do they need to make decisions? And how are you going to get that to them quickly? And how are you going to move a project along, or a new technology that a government is investing in? There's change management that happens, right? And so there's so many things I learned from that experience. And I learned a lot about health information as well, but that's kind of where my background is very different than a lot of people who come into the US government, that's for sure. But I do have a background in public health, which is why I was very attracted to coming to HHS and CMS.
For more on digital service at CMS, visit fedscoop.com.